90.
Hello, a very warm welcome. This is Spectrum on Radio 1. I'm your host, Edmond Kizito. On Spectrum tonight, is Uganda losing the fight against HIV and AIDS? What role can leaders play to respond to the challenge at hand? Pardon me. While Uganda has made tremendous progress in the fight against HIV and AIDS in the past, recent data shows that the country has begun to see a resurgence in this scourge, with prevalence rates now standing at 7.3%. This development has been partly attributed to the rise in the number of people living with the HIV virus due to improved access to treatment and a rise in incidences of promiscuity that has led to new infections even among married couples. These disturbing facts have prompted those fighting AIDS to go back to the drawing board to find a new national HIV prevention strategy and plan of action. At the time when Uganda was revered as a global leader in the fight against AIDS, the leadership of the country had taken the mantle in the campaign against the disease. President Museveni led from the front as the First Lady, Janet Museveni, constantly campaigning against promiscuity and careless love. The increase in HIV infections has come at a time when donors are cutting aid, and the Uganda AIDS Commission has expressed concern that the country faces a deadlock if aid to the fight against AIDS is affected. Protagonists say new infections must be cut by engaging the political leadership on a constant basis. In order to realize this objective, Uganda will mark the World AIDS Day on December the 1st under the theme, Re-engaging Leadership for Effective HIV Prevention. So tonight we seek to understand the current situation of HIV and AIDS in Uganda, the new strategy to combat the disease, and the immediate pressures as far as HIV and AIDS is concerned. Our guests tonight, Dr. Elizabeth Namagala, Senior Medical Officer with the STD AIDS Control Program in the Ministry of Health. You're most welcome, Dr. Namagala.
Thank you very much.
We expect to be joined by Mr. Balaam Namanya, Executive Director of UNASO. UNASO is the Uganda National AIDS Service Organization, and Ms. Flavia Kyomukama of the Global Coalition of Women Against AIDS. In Uganda, Dr. Namagala from the Ministry of Health. What are the latest infection figures on AIDS in Uganda today?
We recently released the results from the national survey that was done last year, and they show that prevalence, the average for the whole country, has increased from 6.4% to 7.4%, and even the new infections over the last 5 years, they used to be around 124,000. Now they've gone up to 134,000 new infections every year.
New infections every year?
Yeah.
What has gone wrong?
A lot has gone wrong. I think somehow we had removed our focus. We're not focusing on prevention as much as we used to initially. We had scaled up care and treatment interventions at the expense of investment in prevention.
Explain that to us. What exactly does that mean?
Of course, you know that HIV AIDS kills, and when we got antiretroviral therapy, there was a push for us to put so many people on treatment, and treatment is expensive. What we call the antiretroviral drugs are quite expensive, and a lot of money was put into making people access care and treatment nationwide, and that somehow removed the focus. And of course, care and treatment is quite cumbersome. It takes a lot of resources in terms of the money itself, but also the staff time. Somehow the focus was so much on care and treatment, and also because it was a treatable disease, there was a bit of complacency from the population, because they were no longer seeing the very skinny people who were about to die as we used to see them, and somehow people had forgotten that there's HIV, and somehow the focus was more on care and treatment. And although prevention was still being supported, I think there was a way in which we sort of like thought that now, because the disease can be treated, although it's not curable, we somehow need to refocus on prevention once again.
Give us some background to AIDS. What is AIDS if someone just came from Mars today?
AIDS is a disease that is caused by the virus, which is called human immunodeficiency virus, and the virus, once it gets into your body, it doesn't get out, even with the treatment that we have right now. Although the treatment can help people recover their immune function, their bodies become strong again, and they are able to fight infection, the virus cannot be eradicated by the medicines that we have right now. So it's a disease that lives long with us. I mean, once you get infected, it will stay in your body for life, and the virus somehow has a way of using the cells that are used to fight disease in your body. It sort of infects those cells. So every time you're trying to fight any infection, that virus gets a chance to multiply in your body. And the other thing about that virus, it enters into your genetic material. You know, anything that enters into your genetic material, your genetic makeup, is very, very hard to get rid of. I mean, it enters into the real essence of your life, the DNA. It goes into the DNA of your cells. So it's very, very hard to eliminate this virus. And even when you have these ARVs or antiretroviral drugs, these drugs do not cure the disease. People eventually die. And the other thing also, even when you take your drugs right, even when you've taken your drugs right, because we tell our patients that they should be taking their ARVs 100%. If at all they are to miss, they should never miss. They should never take less than 95% of the medicines prescribed, and they should be taken as prescribed. Even when they take them right, over time these medicines will not work. So we have a disease that will never probably get cured unless God intervenes and gives us a cure. But right now we don't have a cure, so we need to reinvest in prevention.
Let's get a little bit more clarity here. AIDS is a syndrome, the acquired immune deficiency syndrome. When it attacks you, it destroys your ability to fight disease.
Yeah. It's of course AIDS.
It has no treatment.
It doesn't have. It can be treated, but it cannot be cured. You can treat and remove the symptoms. Okay, as you've said, you've rightly said that it's AIDS stands for acquired immunodeficiency syndrome. AIDS describes the whole collection of symptoms and signs.
It's a collection of diseases.
A collection of symptoms and signs that comprise the AIDS, and it's sort of a result of your body weakening to the level that you can no longer fight the usual things that you fight. You can't fight flu. You can't even the things
that fight diseases.
They're all killed. So you end up being a museum of diseases.
You become a museum of diseases when you have AIDS.
When you have AIDS.
And it is bad.
Yeah, it's really bad because it kills. Even with the treatment we have, people eventually, if they don't, over time, if we don't get better drugs over time, people will die. But at least one thing that has happened is that the treatment that we have right now, although it's not a cure, it can add at least, on average, actually, for people who take their medicines well and were well catered for, well looked after.
Can give them more years.
You can give them up to 20 years. I think it's been said they can live another 20 years.
20 years.
Yeah.
Let's look at the past. Now you can live another 20 years on treatment. Let's look at the past. What was the case before? Paint for us.
Of course, without treatment, if you got HIV.
Let's talk about the past.
In the past, if you started showing signs and symptoms of the disease, within 2 years you'll be dead.
In the past 2 years you're a dead man.
Yeah.
A woman.
Then by the time you start showing
now,
signs.
20 years, they've added a zero.
Yeah. So there's really a lot of change, and probably that has sort of made people think that probably the disease is no longer there. Yet it's still with us. It's still killing people. And even with the new infections that we have, probably would be seeing so many people who are infected, but there are still a lot of people who keep on dying. Because I said we have around 120,000 new infections every year. New infections every year. Yeah, they've risen by around 10,000 over the past few years. So we still have people dying of the disease.
The 64.4%, when was it recorded?
The 6.4 was the prevalence that was recorded in 2005. We had a national
so by a period of 7 years, it's gone up by 1 percentage point.
Yeah, by 1%.
I mean, I remember I was in college, 1985, when I first heard about this. And when I told my colleagues in the cubicle, in the dormitory, they said, you must be joking. They had not heard about this. But in those days, when it landed here eventually, it was called SLIM. Talk to us about why it was called SLIM. Yeah,
SLIM at that time was the name given to the disease because it used to make people very, very skinny, what we call wasted.
You lose weight.
You lose weight, and you're so thin and so skinny. People just remain bones, skin and bones.
Right.
And the name was coined as SLIM. And I think the first cases that were reported in Kasese, I think that's where the name started.
Yes.
That's when people started calling the disease SLIM. And of course, SLIM disease now, for us, we know is a sign of real advanced AIDS. People who have SLIM, those real wasted people, are in the stage 4 of the disease, which is the worst stage of the disease.
Right.
Yeah.
And you had bad attacks, like TB would attack you very, very.
Yeah. Sometimes when they have nothing. I saw a lot of patients who are thin,
but they don't
have any disease, but they were just, in fact, you would just admit them for terminal care. You know that they will die. Even when there was nothing really wrong with them, they were extremely skinny, emaciated, no appetite, they will be in the last stage of the disease.
Right.
We no longer have those stages anymore because now we have better treatment. Many health workers know how to manage. People die, yeah. A few people are still losing weight, especially if they have uncontrolled diarrhea, if they're not seeking care. But now with Septrin, a lot of patients are on Septrin. We give a Septrin. Yeah, Septrin treats most of those infections that would make a person with HIV fall sick. So most of our patients are on Septrin. The moment we diagnose them that they have HIV, we put them on Septrin, and Septrin prevents around 5 diseases. It prevents malaria, prevents diarrhea, prevents pneumonias, prevents sustained brain abscess AIDS patients would have. It also prevents...
Septrin prevents malaria?
It prevents malaria, diarrhea, then certain types of pneumonia. Then there's a particular pneumonia that kills AIDS patients called PCP.
Yes.
And then a certain type of brain abscess.
Malaria, diarrhea, pneumonia.
Then the usual pneumonia, they can prevent the other pneumonias, but there's also a specific one called PCP.
Yes.
Then a certain type of brain abscess called toxoplasmosis.
Okay.
So when you're on Septrin, you're preventing all those a lot of diseases that would have made the patient very, very sickly. Particularly the diarrheas. The diarrheas used to be the ones responsible for people losing a lot of weight.
Right.
Yeah.
Let's talk about the government reaction. Of course, there was Kaposi sarcoma, which was common in terminal stages.
Yes.
One would get, they call it GCP. One gets an attack around the waist. It looks
okay.
At that time, you really are going to...
Yeah, herpes zoster. The GCP is called herpes zoster. That is stage 2. The disease is staged according to severity of the signs you show or the symptoms. And we have stage 1 where people don't have a lot of... They usually just have enlarged lymph nodes in 2 or more areas. And then stage 2, they start getting some signs on the skin, the mouth, and that's when they get the GCP, what is called herpes zoster.
Herpes zoster.
Yeah, and normally it's what people have got. People who get GCP have got chicken pox before as children, and then when it recurs, it comes as GCP. But it usually happens when your immunity has gone down. So when you see GCP, most of the time it means someone's immunity has gone down. It may not be only HIV that can bring your immunity down. You can get a few old people getting it as well, or maybe extreme stress also can bring it out. But normally when you see GCP, you know that that's stage 2 of disease. What you've talked about, Kaposi sarcoma, is a cancer of the skin and the blood vessels. That one normally occurs in stage 4. So when you see Kaposi sarcoma, you know that it's stage 4. And right now we no longer want people to reach even those stages, because once someone is in stage 3 or 4 of the disease, we give them antiretroviral therapy.
Listen, at the first spectrum on Radio 1 tonight, is Uganda losing the fight against HIV and AIDS? What role can leaders play to respond to the challenge at hand? Our guests tonight, Dr. Elizabeth Namagala, Senior Medical Officer with the STD AIDS Control Program in the Ministry of Health. We will be able to call in and contribute to this discussion at some stage. Dr. Namagala, let's go back a little bit in the early 80s, the late 80s, when this disease was recognized here. As soon as those things came up, in those days you could tell a man had AIDS literally by looking at them. Now you can't. Yeah. I'm using very broad terms.
Yeah, those days, of course, people who were sick, most of them could show very easily because the care wasn't good. There was no Septrin. People are not on Septrin. So when you had the disease, you would actually succumb to the disease very fast. But these days, people are on Septrin. Even before they start ARVs, at least we are able to prevent so many of the infections that would have killed them. So people are healthier than before, and they can live. They are more hopeful. And somehow there's been that sort of like lack of fear of the disease. And there are some people who have not even seen AIDS patients, especially the young generation. And we need to...
It's a myth for them.
Yeah, it's a myth for them. We need to come out and tell them that the disease still exists. Luckily enough, our young people don't have a lot of HIV. When you look at our results of the Sero survey, yeah, the prevalence is still low, but as they get married, as they settle down in marriage, many of them get the infection, because the process of getting married is the process that infects most Ugandans. People do not screen themselves before they get married.
People don't test before they get married.
Yeah, they don't, yeah. So, and mainly because people don't look sick. If you've not known your status and you find a partner
and they look good,
you think that they don't have HIV. So you find the prevalence is low when people are below 20 years of age, but as they start choosing partners, settling down in marriage, the prevalence climbs, and it's highest between the ages of 30, above 30 and 40, between 30 and 45. That's when we have a lot of HIV, even amongst the married people.
Even among the married.
Yeah.
Let's talk about what happened when government realized AIDS was here. What did they do? Talk to us about those days.
Yeah, when there was Of course, the first time when we got to know that there were people falling sick and they were skinny and they were dying, a lot was done.
There was national alarm.
There was national alarm, and then of course they tried to test, and then the first cases to be confirmed were as early as 1982. But there was not much done, because I remember at that time you had war going on. It was after the current president came in, and in 1986, before Museveni came in, I think in 1986 that's when something was done in terms of a national response, an organized response in the country. That's when the National AIDS program was established. With Dr. Okwari at that time, and then there was a big program that was started just to educate the masses about the disease. I think you remember the drums that were on radio all the time.
That sound like they're coming from the dead. You hear them, you go home.
There was a massive response from government and partners to put the messages out that there's a disease that kills very fast. And of course, the messages that time, Uganda was one of the countries that pushed for abstinence, being faithful, and use of condoms. And that message really worked, because people really got scared. And that time even they would see the skinny people, you'd see people die. So people sort of got scared, and there was no treatment. In fact, if you got the disease, it was a death sentence for most people. The only thing we had was counseling, and at the same time, I think that's when we had some of these organizations like the AIDS Support Organization they came out and started counseling people, and people were actually living on counseling. They were just being counseled to live positively. So most of our response initially was more of educating the masses about the disease and making people...
A psychological battle, fighting back with your mind.
People were counseled to live positively, to be faithful, to abstain until they found the right partner, to test themselves. And it was basically education, but also we started, when we got information that actually separating can also improve, we also introduced it in treatment centers. But most of the treatment was about separating and treating diseases as they came. It was, I think in 1990, that's when I think the AIDS Commission was established. It was also established because we realized that the disease is we need to have a multi-sectoral approach. All the ministries had to have a sort of an AIDS control program that would address issues pertaining to HIV AIDS and make sure that they control the disease. So that's when that also came up, and over time, I think by 1996 we started getting some few studies that were treating people. There were some drugs that had come into the country. 1996, just CRC gave out a Joint Clinical Research Center was able to treat patients with 3 drugs, because initially people were on one drug. In 1992, some people were just on studies. You try one drug and then people went on that drug, and one drug was not good because that virus gets resistant. So those who are able to keep alive on that drug were able to start on the 3 drugs by 96, and many people of course died. But by 96, I think those who could afford could buy the 3 medicines, the combination drugs. AZT, at least it had to be 3 medicines, and that's when people started living long. And 2000 we started the prevention of mother-to-child transmission program, where we're giving nevirapine to mothers who are pregnant and during labor to prevent transmission of the infection to their children. And it was in 2002 that's when some centers started treating. I think one of the centers that started giving out treatment very early was a center in Masaka and also Arua. They started giving the triple drug, the combination drugs, combination ARVs to patients. And it's only in 2004 that our free program in the country started treating people widely. So all the time, we mainly depended on the prevention messages going out. We didn't have much treatment. But once treatment started in 2004, many people got better. We stopped seeing those very sickly or skinny patients. And people sort of thought probably this disease is now manageable. And we can do as we wish. And somehow the prevalence from 2000 stopped reducing. It stopped reducing. Actually, the prevalence was so high in 1992. Some of the pregnant women tested. In some of the treatment sites, I think it was on average the whole country was around 18%. But in some treatments, in some antenatal clinics, some mothers that were tested, around 30% of them were HIV positive.
That's really
yeah, but then it fell, and by 2000 actually it went to around 6.4%, the lowest. But since that time it's not really gone.
It's now gone.
Yeah, it's sort of flattened. From 2000 it's never gone down.
All right.
Yeah.
And you said the emphasis is no longer on prevention, it's being clear.
The emphasis, although we did still put money in prevention, the fact that we could treat people made people think that the disease can be prevented.
Now? There was a time it was
1.3 million Ugandans are living with the disease.
Let's look at what AIDS can do to a community. Let's go to Rakai, which was the epicenter of this crisis. What can AIDS do to a community? Talk to us about Rakai.
Well, of course, Rakai being the part of the country that had the early epidemic, the epicenter. Yeah.
Then it's somewhere else where you saw the ripples.
Yeah, Rakai, of course, the disease sort of like decimated the young working class, the people who were young that time, who were the breadwinners of the community, were all wiped out. I worked in Masaka myself, and I visited Rakai, but you'd see a lot of buildings that were never finished. But it tended to affect the businessmen. I think if you remember, the disease first affected people who are traveling to Tanzania or doing business.
And then they said it was witchcraft.
Yeah, so it killed a lot of businessmen, people who are working, because it affects the young people. So it really affected the economy of those areas, and it left a lot of widows, orphans. Some households even were closed, and it left a lot of child-headed homes. It disrupted the whole community life in those areas.
Let's look at the reality. I've been to Rakai, and I've been shocked. I've been to many parts of this country. There's no place like Rakai. I've seen homes, modern homes, with large compounds locked off, and people go, they bury the last person, they go, and they come to slash the compound.
Yeah, that really happened in Rakai, and people lost all their children.
I was there not long ago. It's
still there, and I've seen many people who have lost all their children. People tell that I had 10 children, they all died of HIV. All of them died. And
I was shocked to find a compound that's been locked with a modern home. They can't lock it, and the neighbors go and farm their gardens. They only come to slash the compound, and they say, I asked one neighboring family, I said, you mean they don't even have relatives in Kampala? They said, no, nobody will come for Christmas. They said, no, they all were decimated. Modern home with a large compound.
Yeah, it really happened. It happened in many times in Rakai. And the other thing also that happened, many people got scared. There's a way in which when the first businessman died or got sick, people thought probably it was because of the things they have stolen.
So some of them,
some of the businessmen ran away from Masaka and Rakai and came and settled in Kampala. Of course, that probably also brought the disease further to other areas, but it sort of killed the business in those areas, because many of the businessmen thought it was witchcraft, and if you got rich or got into business, you'd easily die. So there was a lot of migration. So it really affected the economies of those areas, left a lot of orphaned children. And I think that those children who grow up during that time probably didn't have people to parent them very well.
Yes. Okay. Yeah. And I've seen child-headed families. Child-headed families, grandmother-headed families.
Yeah. Of course, when you leave children who are orphaned, they're also more likely also to get infected, because they are left alone with nobody to look after them. But we thank God that some organizations came up to support some of them.
We'll talk about those organizations. We have known about World Vision and other people. This is Spectrum listeners on Radio 1. Tonight, is Uganda losing the fight against HIV and AIDS? And what role can leaders play to respond to the challenge at hand? We're going for a break. We'll be back. To stay tuned.
Wow, this is a really nice place. So is there something you wanted to tell me, honey?
Sweetie?
Uh-huh.
We've been together for a long time, and I want to take this to the next level. And I think we need to start by dialing 135*1#.
Huh?
MTN Zone allows you to save more for the things you love. To activate, dial *135*1# to enjoy up to 99% discount on all your calls.
Honey, is that all?
No, honey. We should have voted for more soup, huh?
Waiter!
MTN. Everywhere you go.
Excuse me, guys. Let me through, please.
Yes.
What?
Check this guy. Goodness, dude, what are you doing? Get real.
Just move
Just
a little.
what?
A little bit.
Man, what are you doing bringing a cow into the sitting room?
It's just for when I want milk.
Just what?
Just please move. Let it come and sit here.
What's wrong with this guy?
You cannot keep a cow in your home, but you can get the freshness of its milk straight from the farm into your home. Get fresh dairy milk for freshness straight from the farm every day. Fresh Diary, so fresh.
Discover the new invigorating taste of Red Vodka Lemon. Red Vodka Lemon. Reinvent the night. Not for sale to persons under 18.
Spectrum on Radio 1 FM 90.
Welcome back on Spectrum. Tonight, is Uganda losing the fight against HIV and AIDS, and what role can leaders play to respond to the challenge at hand? Our guest tonight, Dr. Elizabeth Namagala, Senior Medical Officer with the STD AIDS Control Program in the Ministry of Health. You will be able to call in and ask questions or make general comments and contributions. Dr. Namagala, let's talk about what new strategy the government is crafting to counter this rise from 6.4% to 7.4%.
Yeah. First of all, as a theme for the World AIDS Day says that we want to re-engage leadership for effective HIV prevention. We want to re-engage them. We want our leaders to take up that mantle of spreading the message. And
Who's re-engaging the leadership?
Yeah, the leaders are at various levels. You yourself, you're a leader for yourself. You must be a leader for your own health, but also people in their families, fathers, mothers, they are all leaders. People are leaders in their own entities, but we want leaders, teachers, church leaders, politicians, to talk about the disease, to remind people that this disease still exists with us. And we want real commitment, not just commitment in terms of word, but we want people to really invest time and energy to talk about the disease and educate people about the disease and be responsible for themselves. The other thing that the government is doing is to target new infections. We've realized that probably we've done so many things to fight HIV, but we're not tackling where the infections come from. And we've identified the populations that actually have, that cause a lot of HIV. Like, for example, we know that mother-to-child transmission of HIV contributes around 18% of our new infections.
18%? That's high. And it's
that's really high, and it's preventable. So,
how do you prevent it briefly? You don't breastfeed the child, you give the mother...
No, we recommend breastfeeding. Right now, the Ministry of Health with partners is rolling out a new plan to eliminate mother-to-child transmission by giving...
So in the past they used to say you don't breastfeed. You take care while giving birth, but then you also don't breastfeed.
No, even at that time we breastfeed. The policy is that we've never actually refused people from breastfeeding.
Yes.
We tell them that there is still risk of transmitting the infection, but we tell them to breastfeed their children exclusively, just giving breast milk, no other feed for the first 6 months. Yes. Because it was found that if you mix breast milk with any other feeds or any other with milk, you damage the intestine and the virus is more likely to cross because there's some virus in the breast milk. But if you mothers who...
If it's exclusive, then there's no infection.
Yeah, if it's exclusive, there's less infection. But what we are doing...
What do you mean less infection? Why not stop?
Of course, we would have stopped infection, but our mothers cannot afford alternate milk. And our children were dying of diarrhea. They can be prevented from getting HIV, but then they die of diarrhea because of the other milk that is being given. And especially our cow's milk here in Uganda is not very good, it's diluted. So we recommend that mothers breastfeed. Right now, actually, the new policy is that mothers breastfeed their children up to 12 months, but they must be on medicines to prevent the virus from crossing to the child. The medicines, the ARVs they are on reduce the virus in the blood and also in the breast milk, so there will be no virus to transmit to the child.
All right.
Yeah. So for EMTCT, okay, right now we are rolling out what we call option B+, where for mothers who are pregnant and are HIV positive, they'll be put on ARVs for their own health for life.
Yes.
And once they're on ARVs for life, those ARVs will reduce the virus in their blood so that their child that they are carrying will not get the virus. Actually, countries that have already done that, giving ARVs to all pregnant women for life, or during the time when they are pregnant, have reduced infections to less than 2%. In fact, in some countries, you rarely find, actually there's almost no HIV in children. You don't find children with HIV anymore. So I want to target that because that's contributing to 18% of our new infections.
That's a large figure.
Yeah, so if you can eliminate, so we are targeting the source of new infections, and we've identified the most at-risk population. They are populations that have a high prevalence of HIV and probably are responsible for driving the epidemic.
Which other groups?
Some of them are like the fisher folk, fishermen, and then we have long distance. No, I don't have them offhand. Long distance truck drivers, mobile populations, people who move from place to place because of work, like you find soldiers, policemen, people who work on roads. They leave their families behind. Even soldiers, they are more likely to transmit or acquire the disease because they've left their partners behind. Sex workers. All those populations that tend to have a high risk of, and then also people who have multiple sex partners.
Right.
Yeah, multiple sex partners. Also people who are in discordant relationships. People who have, if you're in a relationship and you don't know your status, even your partner doesn't know your status, their status, or if the status of that person is positive, you're more likely to get infected. So there are some populations that are actually the sources of new infections. We want to target those, and this time we're not targeting one particular method. We are doing all preventive methods together. Yeah, we are using all tricks to hit the virus.
Okay.
And
let's talk about these ARVs. Exactly, when one discovers tomorrow that they have AIDS, what can they expect? Is it a single tablet that they take? Do they take 3 courses? Do they take it every day, once a week? What happens? Someone tomorrow discovers.
First of all, I think the most dangerous people that we have in the country are those who don't know their status. People need to know their status so that they can seek care very fast. People who know their status are more likely to sort of like protect themselves and protect others around them, because we counsel them and prepare them. And once they are well counseled, they are started on Septrin. Once you test positive, we start you on Septrin for life, and then we monitor you. And to that point,
how many tablets?
Septrin is taken. We have a tablet that is double strength, and they take it once a day.
Not OTC, not over the counter.
It has the strength of the 2 tablets that normally are taken. This time we combined it into 1 tablet so that it's easier for people to take. They take that once a day. Once they are found to be HIV positive, and they remain on it for life.
One every day for life.
Yeah. And then which is 960 milligrams, and then we monitor their progress of the disease. We do their CD4 if we can do it, but we can stage the disease. Once they're in stage 3 or 4, or their CD4 is less than 350 cells per millimeter cubed, we start them on ARVs. And ARVs also for life.
What exactly is an ARV?
ARV, these are drugs that attack the virus and prevent the virus from growing. No, they are ARVs are tablets.
Right.
But they've been designed in a way that they attack the virus at various points.
Physical. Someone is imagining how they are going to manage it. Is it a tablet? I mean, you've told us about Septrin, 1 tablet a day because it's been fortified.
Yeah.
Once they need to take ARVs, what can they expect? A handful of tablets. I've seen a man.
Actually, we have some of the regimens, like we've combined, because as I said, ARVs should be taken at least, we combine 3 different medicines.
Yes.
Because as I said, the virus enters your cells and enters into your genetic material, into your DNA. So it's very, very hard to get rid of.
Yes.
But we've designed, the tablets have been designed to sort of like attack the virus at various points. There are those that attack the virus as it enters into your cells. There are those that prevent it from entering into your genetic material. There are those that prevent the new virus, the baby virus that has been formed to come out. So they all attack at different ways. So we usually combine medicines that act at 3 different points. Yeah. So those 3 drugs, we combine 3 drugs, and those 3 drugs have been combined into. Most people are taking 1 tablet a day.
So the ARVs, you take the separate. On top of that, you get a
So usually we try to simplify the dosing such that people take 1 tablet a day, or 1 tablet twice a day. For those that probably in second line, there may be 2 tablets twice a day.
tablets twice a day.
Those who are on second line, they tend to take more.
That's 5 tablets every day.
Like, maybe 5. But it's not a lot. When you think of the fact that this is saving your life, I mean, there's nothing that is compared to life. Yeah, there are people who are taking insulin and they're injecting themselves.
That's for
diabetes. Now this is just a tablet.
5 tablets once a day, every day.
Like for most people actually on 1 tablet twice a day or 1 tablet once a day. So it's not really a very complicated treatment. The only thing that they have to sort of keep the time. They have to take that. They keep the time in the morning. Some of them are better taken at night. There are those that cause some side effects, like maybe when you've just started the treatment, there's a fibrance that causes nightmares when you've just started the drug.
Take it the first time,
maybe the first 4 weeks, but those disappear over time. But the majority of people, over 90%, don't get any side effects.
But eventually they could disappear.
They disappear. Most of the side effects are there for the first 4 weeks, but after that, no side effects. And we have around 360,000 Ugandans on drugs. Actually, maybe we could be approaching 400,000 Ugandans on these drugs. And they are healthy, working. You can't even know that they have HIV with them. But the thing about ARVs is that you have to take them every day as prescribed. You don't miss a dose, and you must take at least 95% of your medicines. In fact, we tell them they should take them 100%.
So out of 1.3 million people, around 900,000 don't get ARVs.
Around 360 by January, by March this year were on treatment. So we could be having around 360 or 380,000 Ugandans on ARVs.
So 900 people are on ARVs, just waiting to die?
No, they're not waiting to die. Most of them don't even know that they are positive.
Really?
Yeah.
So what would you advise?
So I would advise people to sort of test themselves. People should know their status. At least every year people should test themselves and know their status. Every year people should.
Is there another way you can get it?
Those who are sexually active, surely every year you should test yourself. Test yourself. Never have a child before testing yourself, or going for surgery before testing yourself, because these are really very, major events like having a baby, getting married. You should know your status.
Mothers, every time they give birth, they are tested.
They should be tested.
It's compulsory now in government and health.
It's not really compulsory. We sort of give it as a routine test. But we give the mothers a chance to opt out. It's a routine test.
Really?
Just like
my impression is that when you go to give birth, you have to have.
No, it's not a must. It's a routine test. It's a routine test. They are counseled to test themselves, because how will you prevent the disease from going to the child if you don't know your status? So we routinely give the HIV test to all our mothers, not only to pregnant women, but all people who come to hospital are given a chance to test themselves to have a test. So we recommend that people should have an HIV test, and when they know their status, then they can protect themselves. They can protect their loved ones. They can plan their lives. They can get on treatment, and especially those who are getting married. Our young people. I think we did a study recently, and the prevalence in the young people, the university students, is quite low. Not so low, still maybe around 1 to 2%. But the surprising thing that by the time they are 25, the prevalence has already started climbing, showing that the process of getting husbands or wives affects many of our young people, because people do not test themselves. So I recommend people should, before a relationship starts, test yourselves, know your status, and protect yourselves. And then the other thing also, abstain until you find the right person. And when you find the right person, some people abstain, and when they find somebody, they don't test themselves. I've seen people who abstain, but then they didn't test when they got a partner, so they still got infected. If you're infected, use a condom, but and get a fellow positive person. Don't get a negative person to infect them.
Well, that's really interesting. Talk to us about this World AIDS Day before we hear from the list.
The World AIDS Day. The World AIDS Day is a day that was chosen to remember the disease, to remember HIV infection all over the world. It's celebrated all over the world. It's first. We sort of like, it's a day for focusing our attention and remembering that we still have HIV, remembering those who have died, remembering all the efforts that we put in to fight the disease, and sort of like, it's more of a day for advocating or re-engaging ourselves so that we know that we still have to fight the disease. And sort of we have a theme that sort of motivates us to move forward. The theme for this year's World AIDS Day is re-engaging leadership for effective HIV prevention.
Yeah, and talk to us a little bit more about this new strategy. In the past, I remember you had a campaign for young people. It was called SYFA, SYFA, which of course the acronym came to mean I won't die of AIDS, but it meant safeguard the youth from AIDS, and they used to sing it in high schools and so on and so forth. I won't die, SYFA, I won't die. Are you having something in mind, something similar, or do you think the youth are free?
This time we are focusing. This time for the youth, actually, we have, in addition to all the other things we said, abstaining, being faithful to those, to a negative partner, and using condoms for those that cannot abstain or cannot be faithful. We are also recommending circumcision. As I told you, we are using so many different preventive methods for this disease.
What is about circumcision?
Yeah, circumcision. We recommend for people who are from 14 years of age. We recommend circumcision. Of course, we would also recommend that if mothers have delivered sons, they can circumcise them when they are still children. But right now, we are targeting those that are older. The 14 as means of health, we are targeting the older population, where we'll have more impact.
What does that cut do?
Yeah, the circumcision, the process of circumcision removes that foreskin, and after some time, there's a scar that forms along the head of the sexual organ, and that hardening protects.
It's hard for it to get in.
It protects the skin.
It gives room for incubation.
Yeah, that foreskin has some cells that actually are very, very receptive to the HIV, to the virus. There are some cells that under the foreskin that are very good they have very good receptors for HIV. So when you remove the foreskin, at least you remove those cells, they are gone, and then it's replaced. The skin is replaced with scar tissue, which is harder and tougher for the virus to penetrate. But at least you remove those cells that are really a target for what?
Ventilators.
Yeah. And even usually when people have STDs, that foreskin around there that tends to have a lot of sores and all that, so it leaves a raw area when people are not circumcised for infection. Yeah, so circumcision really helps to reduce it doesn't really eliminate the risk of HIV, but it reduces it by around 50%. So around 50%, and that's really a very good reduction, because we don't have a vaccine. We can't prevent it. So anything that can reduce the risk of acquisition of HIV is really good for us as a country.
The listeners, this is Spectrum on Radio 1. Tonight, is Uganda losing the fight against HIV and AIDS? At what role can leaders play to respond to the challenge at hand? You can call in now. Our number 041-4348-111, 031-2260-390, When you call in, please tell us your name and where you're calling from. You're talking about circumcision. We just lost a caller there. You're talking about circumcision. There are tribes that undertake circumcision as a cultural ritual. Do we have figures of AIDS prevalence there, maybe to back up the circumcision?
Yeah, when you look at the average prevalence for the whole country, it's around 7.4. But when you look at those populations that circumcise,
let's hear from this caller. Spectrum, hello. Hello. We don't seem to be able to connect there. Please do try and call back in. We will be able to get in, I believe. We will try to rectify that issue. Dr. Namagala, talk to us about those people who cut early.
Yeah, those that circumcise have been found to have a lower prevalence. As I said, circumcision does not eliminate the risk. Bagishu, Bakonjo, and the Muslims. Yeah, but they still get HIV, but not at the rate at which other people who are not circumcised get it. So we want to tell people that circumcision is protective, but it's not 100% protective. So
we have figures. I mean, the Bagishu community.
I think their prevalence was around 5.4. Yet when you compare it to the average, 5.4, 5.6.
Yes, Dr. Malo. Yes, Mr. Vicinity.
much for those questions. The first question was about what we are doing about procuring expired medicines for ARVs. My answer to the first question is that we as a country don't buy expired medicines. ARVs tend to have a shelf life of around 2 years. That means that's a short shelf life. And as a country, there's a policy that they can only bring in medicines that still have at least 75% of their shelf life.
Yes.
Yeah, so we don't bring in expired medicines, and the medicines that come in have been approved. They've gone through stringent examination processes. Yeah, medical stores. They are tested and all that. So we don't buy. They may expire maybe at the facility, but we don't buy expired medicines as a country. And then Mr. Kashera asked about circumcision. The confusion about circumcision. As I said, circumcision is not 100% protective. It reduces the risk of transmission of acquiring the disease. Actually, it protects the man who has been circumcised, not the woman.
That's what the 50%.
Yeah. No, it reduces the risk of getting the infection by 50%. Yeah. So that means that some people,
not the woman.
It protects the man, not the woman, actually. Because if you had HIV and you're circumcised, you still transmit the infection. Right. So I want to circumcise people because we are using everything that we can do to prevent the disease in this population. Right. So anything that reduces risk of infection by 50% is really it's a big plus. It's a big plus because we don't have a vaccine. And somebody asked about what's the logic behind circumcision. As I said, it's not 100% protective, but we've seen that the populations that circumcise in Uganda have a lower prevalence. If you look at our new data, I think that the east, where there's that circumcision, has around 5.6%. Yes. Yet the average for the country is around 7.4%. The Bakonjo, Bagiso, they have lower figures, but they are still getting infected, and the Muslims also. I don't have them off it, but I think the last figures, when we had 6.4, the circumcised were around 5%. So it still shows you that even the circumcised, it still shows that even the circumcised are getting infected. And the other thing also about circumcision must be done in a safe manner. It must be safe, done safely, because even the process of circumcising, if you're doing this traditional one and you're using knives, sharing knives, you could pass on infection to other people. The other thing also, the first 6 months after circumcision, the skin is not yet well hardened, so there's still risk of infection. So I tell people for those first 6 months they should abstain. Yeah, they should, because the scar or the protection is not yet there. Right. It happens after 6 months. So even when 6 months, after 6 months, yeah. So we need to protect. Yeah, we recommend even after circumcision, people should still use condoms the right way, consistently, and for every go that they have of sex.
Let's talk about Harry. It sounded like a young individual. He said that how really do you get AIDS or HIV to your body? Is it transmitted through semen? Give us that science about the blood, the saliva, and so on. Kissing.
Okay, because HIV, I think about 80% of the infection that we have in Uganda is transmitted between a man and a woman. And the process of sex, when someone has the virus, that virus for HIV, it will be in the secretions, the sexual secretions, both the man and the woman. If you have infection, that infection, the virus will be in your fluids, but it tends to be in a high concentration in the sexual organs. I don't know why. In fact, even when people are on treatment and the virus is not in the blood,
you knew that's where the attack from.
Yeah, the virus tends to be in a higher concentration, even in those sexual fluids. Even when people are on treatment or on drugs, the virus tends to hide in the genitals. It tends to hide in the sexual secretions. That's why we tell people to use condoms and use them right, because there are cells in the sexual organs that tend to harbor that virus. And it's even worse when you have an STD, because when you have an STD, your body comes out to fight that STD. And as I told you, this virus tends to affect those cells that fight disease. So when you have a disease, those cells that are fighting tend to have even a higher concentration. So if you have an infection in your genital area or in your sexual organ, you have all those cells that have the virus or are more likely to even acquire the virus. So those are the things that cause.
80%. What about
blood transfusion? Because we screen our blood
well, even as people have sexual intercourse, they could get lacerations blood
Yeah,
how much?
because now the virus is in the secretions. Anything that, if it's a cut during sex days, usually small cuts that are microscopic, you can't even see them. People may not even know that they've got, they may not even feel them, but those small abrasions and all that will make the virus cross directly.
Without going through.
Yeah, it's worse if you have an infection. Like if you had an STD, then it will cross. And if a man is not circumcised, that foreskin also has a lot of those cells. So that foreskin also has those white blood cells that are easily infected by the what? Right. By the virus. So all those things really make the virus spread very fast.
Okay, perhaps as we go, David said it's a reality check. Basically, it's beating the drum again. AIDS still kills.
AIDS still kills people. Although we said that treatment that we have, the ARVs and the Septrin, can add up to 20 years of life. Even more if you take the drugs very well. And if you go for checkup and you maintain treatment and you eat healthy, you can add up to more than 20 years of life.
But you will not get cured of it.
But the virus remains in your body. Because the virus has been found to hide either in the brain, as I also say it can hide in the lymph nodes, it can also hide in the genital area. It has some cells where it hides and doesn't get eliminated even when you're on ARVs. We say people have to be on ARVs for life. Yeah. So as I said, there's something about the secretions, the sexual secretions, and the genital area that harbors that virus, even when you're on treatment.
Okay. Dr. Namagala, maybe perhaps as we go, I mean, the message is clear, AIDS still kills.
It still kills, yeah.
If you have to avoid it, stay away from sex if you're not married. If you're getting married, test before you get married.
And be faithful to your partner. Be faithful to a negative partner if you're both negative. Right. Be faithful.
If you're both positive and decide to get together, use condoms.
Use condoms. Condoms are really very, very effective if you use them consistently.
Okay, we'll have to go back. Talk to us in half a minute about the World AIDS Day. What is it taking place? You taking
the celebration for the World AIDS Day this time, because we want to re-engage leadership, we decided to go back where the first cases of HIV were first reported. The first cases of HIV were reported in Kasensero, which is a fishing village in Rakai. Yes. That's where the World AIDS celebrations are going to be. World AIDS Day celebrations are going to be on Saturday, which will be the 1st of December. As I said, this day is celebrated every December the 1st.
Thank you very much, Dr. Elizabeth Namagala, very knowledgeable, Senior Medical Officer with the STD AIDS Control Program in the Ministry of Health. Thank you very much for tuning in. I've been your host, Edmond, Kizito Spectrum. We'll be back tomorrow. Up next, the news in English.
The Western Union Choma Hour is here. Win lots of goodies this festive season. Listen to your favorite radio